Tonight, there's a rare disease infecting people around the globe, and it's not coronavirus, it's monkeypox.
Honestly, I feel like at this point, it's not even a surprise anymore. I'm just waiting for the apocalypse to happen pretty much.
It's not the apocalypse, but on Wednesday, officials confirmed a first U.S. case of the virus this year in a male patient in Massachusetts. Now, a second potential case being investigated in New York City.
The patient was placed in an airborne infection isolation room in our special pathogens unit.
According to the CDC, monkeypox was discovered in monkeys in 1958. More than a decade later, it spread to humans. The first case was found in the Democratic Republic of Congo in 1970, and then more in remote parts of Central and West Africa. By 2003, the first monkeypox case hit the U.S.
A bizarre new viral outbreak right here in this country.
Since then, experts say widespread smallpox vaccination likely curbed monkeypox infections worldwide. But it's back. As of Thursday, countries including the United Kingdom, Portugal, Sweden, Spain, France, and Italy have newly confirmed cases. The World Health Organization now deploying an incident response team in the UK with at least 8 cases there. The U.S. case is a man who recently traveled to Canada. He's hospitalized and in stable condition.
The current patient is of no public health risk right now, and people should just be aware of symptoms, but not be afraid in any way.
Symptoms include fever, fatigue, fluid-filled bumps, and lymph node swelling, with specific communities at risk.
The risk factor here has been men having sex with men.
The CDC says, regardless of sexual orientation, monkeypox can spread through contaminated items, fluids or sores, or air droplets of an infected person, though the virus does not spread easily.
At this time, we don't want people to worry. At this point, again, these numbers are still small. We want them to be aware of these symptoms, and if they have any concerns, to reach out to their doctor.
Still, officials warn that they see no clear links between the Western monkeypox infections and countries where monkeypox usually occurs.
What we have seen in the United Kingdom, in Spain, and in Europe has been novel, and that gives us cause for concern.
Okay, Zinhle Essamuah joins us now live from here in 30 Rock. So Zinhle, you mentioned that breaking news tonight, another potential monkeypox case here in New York City. What do we know about that?
That's right, Tom. And it seems the virus is spreading fast. We know that the New York Department of Health and Mental Hygiene announced a possible case of monkeypox in New York City just this evening. The patient is being treated at a local area hospital. That said, I need to emphasize monkeypox is rare. Experts at Johns Hopkins say most clinicians will never actually see a case in their lifetime, and others caution against comparing monkeypox to COVID because, unlike coronavirus, Tom, monkeypox is not novel. It has been studied before. We've seen it. And according to the CDC, most people will recover in 2 to 4 weeks, but still definitely something to watch.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.